Welcome to Beyond the Limits with your hosts, me, Matt Clark, and my co-host, Mike Forsyth. This episode, we are exploring hair loss. We're going to be exploring the reasons why hair grows, the reasons why you might be losing your hair, and some of the disease processes. You're going to learn about some of the medications and preparations that you can buy to change this, and some things that may be prescribed. And as a reminder to our listeners, we're not affiliated or sponsored by any of these products. Now, for those of you listening who tune in for the wisdom of our guests, I guess you can tune out and see you next week, because this week it's just me and Mike battling through this subject. Now, Mike, I'm not sure about you, but my hair corners are getting more and more acute, and I'm aware that your luscious locks are pretty strong still. So I'm wondering if you're actually interested in this topic.
Yeah, I'm interested in it, and it's not all going for me here. I mean, I'm as grey as can possibly be, and I have been probably since qualifying as a doctor. So yes, my hair is quite thick and I'm happy with that. But at the nursery the other day, a grandparent asked me who my grandchild was, and that was a low moment.
Over the last 5 years or so, started to become a bit more self-conscious of it. I've always had quite a good head of hair myself, but I think just recently I'm starting to think, I'm actually starting to look quite old and haggard. I'm wondering if it's the small kids that kind of drive that. This is quite a big issue, isn't it, Mike? It affects a big part of the population.
Yeah, and it does. And I'm joking. We're joking about it, and it is commonly a joke, isn't it? But actually, the reality of this is that yes, it's common, but yes, it's got a huge impact on sufferers of this. So I read a really interesting stat that said that 60% of hair loss sufferers would rather have their hair back than friends or money. And I guess it stands to reason in a sense. You know, hair loss can significantly affect your mental health, your confidence, and with it being so common and this being such a prevalent issue in both men and women, I think that's an important point to mention, because I think receding hairlines and hair loss, we think that that's a male issue, but actually it's not just confined to men. Women often do notice hair loss or hair shedding, so it is an issue for a lot of people. So a big issue, and one that actually can have quite far-reaching effects. It's not quite as simple as saying, oh, your hair's just a bit thinner as you get older. This can actually affect people in a number of ways.
Yeah, totally. It's really, really important to many people, and it's the social stigma of losing hair because of the way we kind of perceive each other and the way we perceive health by just looking at someone and thinking, wow, look at those luscious locks. They must be really healthy. Right, let's get into the crux of this. So before we talk about these certain medications and different therapies and strategies, Mike, do you want to give us an oversight? Because I think it's important understanding the physiology or how hair actually grows. It's important to understand that before understanding how you can treat it, because there's different ways in which people lose their hair, aren't there?
Yeah, definitely. I think this will hopefully provide a little bit of context. I'm going to try and keep this quite brief because I don't want this to turn into some sort of lecture. But just for context, I think this will be useful when we move on to the next stage. So hair essentially grows in 4 different phases. So you've got, very simply, your growth phase, transition phase, resting phase, and shedding phase. Each of these lasts a different length of time. So classically, your anagen, so your growth phase, that's around sort of 2 to 7 years, and this is where your hair actively grows. And about 85 to 90% of scalp hairs are in this phase at any time. You've then got the transition phase, which is where growth stops and the hair follicles start to shrink. Resting phase, your hair kind of sits in place but isn't growing, and that lasts about 3 months. And then finally that shedding phase where old hair falls out and then the whole cycle restarts. So each hair follicle operates independently, and that process is really to prevent mass shedding, so all of your hair falling out at once. Interestingly, those hair follicles are genetically programmed to determine their growth duration, how sensitive the follicle is, particularly to hormones like DHT, and we're going to touch upon that a little bit later on in the show. And also for your hair type and colour, so whether it's curly, straight, thick, thin, dark, white, whatever it is. There's also this concept of miniaturization of hair follicles. So that's when hair follicles shrink over time. They produce thinner, shorter and weaker hairs until they stop growing altogether. This can be influenced by a number of things. So hormonal factors, genetics as well, and also a reduced blood supply to the follicles. And miniaturization is a key process in androgenetic alopecia, so the pattern baldness, your male pattern baldness and your female pattern baldness.
Just going back to the growth duration, I read something interesting about how, like you said, it's all pre-programmed, it's preordained from your genetics, how hair responds to certain hormones. And I just thought it was interesting that the hair on your face, for example, your eyebrows, the growth phase is significantly shorter than the hair on your head, which is why you don't need to go to the hairdressers and have your eyebrows cut in the same way that you do the hair on your head. Some people have this exceptionally long growth phase where if they don't cut their hair, it just grows to the floor or grows down to, below their hips, whereas most people, I think it would stop growing at kind of shoulder length.
The barber always shaves my eyebrows. I always get a bit freaked out by it, to be honest. Took a big bald patch out of it last time.
Really? Yeah, my wife is always coming at my eyebrows with scissors, saying that I look like a kind of mad professor. And I'm like, leave me alone. I quite like my long eyebrows.
We shouldn't be gloating. We're on the lucky side here.
Yeah, true. So moving on to, I'll touch on the different types or the different reasons why people lose their hair, and I'll just try and go through this in a structured way. So you mentioned about the androgenetic alopecia, and alopecia is just an umbrella term for hair loss. And so this affects men more than women. 30% of white men are affected by the age of 30. This goes up to 50% by the age of 50, and 80% of white men are affected by the age of 70. Now, androgenetic alopecia is the sensitivity of hair follicles to this very powerful version of testosterone called dihydrotestosterone, or DHT.
Yeah.
Now, the different hair follicles on your head respond to this hormone differently, and that is part of their genetics. Men have a certain pattern of hair loss due to the areas of the head that are much more sensitive to this hormone that prevents hair follicle growth and inhibits the growth of hair follicles. This also affects women, but it's less common in women. 10% of premenopausal women have some evidence of pattern hair loss, and this incidence increases around the time of menopause. It does affect up to 56% of women over the age of 50, and around half of women will experience some form of this during their lives. It's a bit of a coin toss. So this androgenetic alopecia is all to do with how the genetics of hair follicles respond to this form of testosterone, this DHT. Moving on to cover some endocrine disorders or hormone imbalances, so things like hypothyroidism, polycystic ovary syndrome, other hormone imbalances such as postpartum women or postmenopausal women who experience a significant drop in their estrogen levels, all can experience hair loss. Then there's something called telogen effluvium, and what a kind of beautiful term this is for quite a dramatic shedding of hair. Now, this occurs in response to a triggering event. It occurs typically around 3 months after such event and is usually self-limiting, but can have this quite dramatic hair loss where women describe kind of pulling out clumps of their hair. Triggers for this can include childbirth or excessive dieting, severe infections, major surgeries, or a really commonly one known is some of the toxic implications from chemotherapy. There is also a condition called alopecia areata. So this is an autoimmune condition, and this is characterised by this kind of diffuse, patchy shedding of hair in these sharply defined areas. Now, this typically affects women over the age of 40 and does recover to a certain extent, but is quite unpredictable. And then there's things like poor nutritional status. So if an elderly person is deficient in protein, for example, then they just don't have the nutritional building blocks to make things like hair, for example. Now, I've seen this in practice as well, Mike. I don't know about you, but people lacking in iron, for example, or even vitamin D deficiency can also present with hair loss. Moving on now to a new section which I'll summarise as scarring alopecia. And I think this is important to keep distinct from the ones I've already mentioned, because these cause permanent hair loss to the affected areas. So there's something called frontal fibrosing alopecia. This can affect women typically on the front of the scalp. It's quite rare. It most commonly occurs in women who've gone through the menopause. There are also things like infections, so tinea capitis, so fungal infections of the scalp can cause this scarring hair loss. And then there's also systemic conditions, so for example lupus. This can present with this patchy, kind of scarred scalp with irreversible hair loss. The reason I think that's important to keep distinct, because we're about to talk about lots of treatments for hair loss, and it's important to highlight that some conditions just simply wouldn't respond to lots of these treatments, and we'll try and bear that in mind when we're talking through each one through.
Let's move on now to the available treatments. So this is really the crux of what we wanted to talk about, because as I alluded to at the start, hair loss treatments are big business. So there are a whole lot of them out there. And it's really hard to know, I think, what works and what doesn't. So I think if we go through these one by one, we'll talk about a couple of the big players first off. I mean, I think we're not really touching particularly on hair transplants here. Although I think we've all heard stories of people disappearing off to Turkey to get those done. Turkey because it's cheapest, to be honest. I mean, certainly I've heard stories of people returning having had this done, and their flight is just full of men in their 30s and 40s, all with the same bandage around their head, like they've returned from some distant war zone. So it's, again, that is that's certainly a big part of how this is dealt with. So finasteride is one of the commonly used medications. So this is primarily used to counter male pattern baldness, and this reduces the action of DHT, so this dihydrotestosterone, on hair follicles. As you said, Matt, DHT is a naturally occurring molecule. It interacts with these hair follicles in a way that causes a growth phase of the hair cycle to gradually decrease. This shrinks the follicle, resulting in thinner, shorter hairs until the growth phase is so short that the hairs don't grow from the scalp at all. So essentially what finasteride does is it stops that production of DHT, and it does so by inhibiting something called 5-alpha reductase. So that's the enzyme which converts testosterone to DHT. And essentially that means that there's less DHT present in the scalp. So this helps to prevent further hair loss. There are claims that it also can promote hair regrowth. That's a little bit controversial in terms of the evidence of that. It comes in two forms. So you can either get the tablet form where you take a daily dose of medication, or there's a topical version as well that you can put on the scalp. So when we look at the evidence of both of these, the oral finasteride, so the finasteride medication, does have some really good evidence for its efficacy. The topical form of the drug has some evidence. It's not quite as convincing, but there is something there. The oral medication is quoted as reducing DHT by about 70%, whereas the topical, slightly less than that, around 25 to 30%. The feeling is that medication can maintain results for a decade or so, whereas with a topical medication, you need to use that on a continued basis. But what is really worth pointing out with these is the side effects, and I think these are really underappreciated at times. So, look, topically, this is a pretty well-tolerated medication that can cause a little bit of scalp irritation, but orally, it can cause quite a few issues here. So, commonly quoted sexual dysfunction, this is about 2 to 5%, but I'm concerned a little bit about how underreported this is. There was a drug safety update from gov.uk with regards to this medication, talking about the fact that actually, whilst side effects are rare, they can cause sexual symptoms, and these can actually be irreversible. So these can persist after stopping the medication. So there are other rare side effects, so testicular pain, depression, thoughts and acts of suicide. So not insignificant symptoms here. It's interesting. I had a little look at the couple of the companies that sell this, and Newman was more open about this. So they said that, sometimes this medication can cause side effects. They quote a lower number. So they say in trials about 1.5% of men experience symptoms such as erectile dysfunction. And actually, they have said that stopping treatment usually leads to the resolution of these symptoms in over 99% of men, but in a small number of cases, it may be irreversible. So they have mentioned that. Manuel, I don't know how to pronounce their name. Interestingly, their section on side effects was really quite brief. It essentially said that most people don't have any side effects. It may cause a decrease in libido, tenderness around the nipples kind of thing. I did email them. To date, I haven't received a reply, but I was a little bit shocked at how little publicity this was getting on their website, given that they sell so many of these products, that this wasn't mentioned.
Yeah, I'm really glad you mentioned that, because I had read about this post-finasteride syndrome. We're familiar with prescribing finasteride for men with enlarged prostates, so these are typically men in their 70s and 80s. But reading about this post-finasteride syndrome affecting younger men, after they'd stopped the medication, and it being long lasting was quite shocking and quite disturbing. This idea of having sexual dysfunction, suicidal thoughts after ceasing the medication definitely needs to be more publicly known about. Just rounding off finasteride, I just wanted to make sure that we'd mention for women listening who may be suffering with hair loss as well, that finasteride can be an effective treatment for women as well, but it's typically avoided and contraindicated unless they've gone through the menopause, because of the catastrophic teratogenic effects that it can cause to the unborn fetus. So, women of childbearing age should steer clear of this, really.
Yeah, really good point to make. So that's finasteride. And as I said, spend a little bit of time on that just because that is such a popular drug. The other really big medication that gets used a lot is called minoxidil.
Yep, certainly I'll pick up the rope here. So minoxidil, it's quite an interesting history actually. So it was originally being researched as a treatment for high blood pressure. They had various forms of it, but minoxidil specifically was actually quite a potent medication for treating high blood pressure. But after a couple of weeks of using this, they noticed this abnormal hair growth in the patients, alongside things like fluid retention and salt retention, and also fast heart rates that required a multitude of other medications to control those unwanted side effects. The pharma industry quickly cottoned on to the hair regrowth that they were seeing in some patients and decided to study this further, specifically in the application of hair loss. Upjohn was the original company that produced the original product called Regain or Rogaine in the States. Now this is still around today and it's probably one of the better known medications. Like you've mentioned previously, there are loads of other companies making similar products now. Now minoxidil is typically used as a topical agent, so is either as a solution or a foam that you rub into the scalp. You can actually take it as a tablet as well, and I think some of these companies are providing this now today as well. When used twice daily, it reports that clinically visible results can be seen as early as 8 weeks. And the earlier that you start using Regain, the higher your chances of seeing results. This plays into a recurring subscription, doesn't it? The more you use this, the earlier you use this, the better the results. And actually the evidence stacks up in favour of that as well. And I looked at some independent evidence, but this is back in 2002. This was looking at a total of 393 men with this androgenic alopecia, and they applied either a 5% topical minoxidil, 2% solution, or a placebo. The long story short is that they noticed significant results. They found that the 5% topical was clearly superior to the 2% minoxidil and also placebo. 45% more hair regrowth was found with a 5% solution over the 2% at week 48. Psychosocial perceptions of the men with the hair loss were also improved. Now, I don't think many dispute that this does have a beneficial impact for lots of men, and it's unfortunately slightly random in how this works. So some men might experience great effects, some none at all, and unfortunately that's difficult to know until you've tried it. The side effects are typically itching, kind of increased dandruff, some erythema or some reddening of the scalp. And again, lots of companies providing this now. It's really important to note that the hair gain, so the perception of hair regrowth, if you're lucky and that's what happens to you, that you actually have to continue this medication continuously. As soon as you stop taking this medication, it's noted that in about 12 months, the regains that you'd had will revert back to your previous pattern of hair loss, unfortunately. There are some side effects that I found that don't really appear visible, again, on a lot of these companies' websites. So some patients experience quite dramatic hair regrowth to the point where the front of your forehead can kind of start encroaching towards your eyebrows, which is quite an impressive response. But it can be accompanied by abnormal hair growth on the face, places that you don't want it, on the end of the nose, for example. And it's been documented that this can resemble something called Cantu syndrome, which is a genetic condition where there is a significant abnormal amount of hair on the body. And unfortunately, these patients suffer with other complications such as pericardial effusion. But it was noted that people, particularly when taking the oral minoxidil, who had this hypertrichosis, which is this name for this abnormal hair growth, a number of them were found to actually have pericardial effusions as well. And whether or not this medication is having some impact in a similar way of that genetic abnormality, it has been theorized. And of note, some of the warnings with this medication are that if you experience shortness of breath or chest pain or dizziness, then you should certainly stop taking this medication instantly.
That's really tough, isn't it? I'm just thinking in terms of these subscription services where when we know with a medication that it has some positive effect. But we also know that the moment you stop taking it, it's going to revert back to what it was before. Puts customers and subscribers in quite a tough position, doesn't it? Because you almost kind of get a flavour of what things could be like, but then you're kind of locked in this cycle of just subscribing month after month after month, right?
Totally, yeah. And this is about £30 a month. So this is £1 a day. It's just under £500 for a year. Price is probably going to go up with time. You are locked into a subscription that's going to cost you over the long course quite a lot of money. But again, like you mentioned, this is quite an important thing for a lot of people. It's also worth noting that with minoxidil, there are side effects such as fluid retention, so that's kind of swelling of the legs, and salt retention as well. So these aren't completely benign medications, and it is worth discussing this with the doctor before you consider it. Mike, do you want to just move us on then? I know that you've looked at some other ones.
Some of them are a little bit weird and wacky. So we're not going to spend a huge amount of time on all of them, but it's worth just running through a few just to see what's out there. So I had a look at red light therapy, or what's actually known as LLLT. So that's your low level laser therapy. And this is classically for your androgenic hair loss that we've talked about already. Loads of different devices. You can get a cap that sits or cradles over your head and marinades your scalp in a red laser light. You can also get literal baseball caps that have red lights built into them that you can just walk around, red light on your scalp when you're out and about. There's a bit of mixed evidence. There was a study from a few years back that showed a 35% increase in hair growth compared to placebo, but then this paper also suggested that some studies didn't show a huge amount of statistical significance. There was then a further study a couple of years later, and it said, LLLT is an effective treatment for hair regrowth in both men and women with pattern hair loss. The method of action is increasing this cellular energy production to the hair follicles, essentially reducing inflammation and oxidative stress and improving blood flow to the scalp. So the feeling is that you need to do this for at least 3 to 6 months. It's more effective, as with all these medications, more effective in the early stages of hair loss. And then, interestingly, this addendum that kept being added is this should be used in combination with either finasteride or minoxidil, which made me a little bit suspicious, but there is some mixed evidence, I think, there. Look, it's not cheap. I had a quick look online. I think you can get these things. Some of the really basic models are 200 quid-ish, but these go up to £2,000 and beyond. Again, another addendum that kept being added are that more studies are needed to establish the duration of treatment that's needed. So that's laser therapy. Matt, what have you looked at?
So I've got caffeine is up next. I think caffeine is quite interesting. Caffeine is not one that's been studied heavily by these big pharma companies. And there's probably a reason for that, being that caffeine is cheap, it's readily available, everyone's drinking it. You can probably smear some tea bags all over your hair if you really want to. But caffeine has been shown in vitro to promote blood flow. So what I mean by that is, in cellular studies, it's been shown to increase the blood flow to the hair follicle. And it's also been shown that it keeps it in growth phase for longer. Less evidence for this in human studies, like I said, but I did find an interesting study that's published in 2018. And a long story short, this was comparing a caffeine serum to that of minoxidil. Looking at 210 patients with androgenetic alopecia, it found that it was not inferior to minoxidil 5% solution in the men using this, and this was statistically significant. Now, I've had a quick look online. Caffeine serums are pretty cheap. You can get one from Amazon for about £8, and that's for a couple of months' supply, and that's significantly cheaper than minoxidil. Now, how do you actually apply this? I don't know if for men, if you're going to put this in your hair in the morning, is it going to make it all greasy? If you put it in your hair in the evening, is it going to keep you awake? I don't actually really know. But there is another study looking at how it's delivered, and actually the topical application, so these serums that go on the scalp, deliver caffeine to the hair follicle much more effectively than if you were just drinking, more cups of coffee, for example. It doesn't go through the dermis to the hair follicle as well, and that's been studied and shown. So there may be something in these caffeine serums. I've also looked at estrogen tinctures, so estrogen serums, these kind of topical applications of estrogen. And again, this piqued my interest in considering, so for example, women with these hormone imbalances. I know that my wife, when she was pregnant, she couldn't help but notice her hair was getting thicker during pregnancy. Then after, giving birth, then yes, literally clumps of hair coming out. And I noticed it in the bottom of the shower, like, goodness me, where is all this hair coming from? And that is from that dumping of estrogen that happens postpartum. So I thought, oh, good. Couldn't it be interesting with estrogen tinctures to prevent something like that? Again, this hasn't been studied well in humans. Estrogen is a cheap hormone to make. It's easy to copy. Big Pharma are not going to be interested in this. The biggest study that I could find here was looking at a comparison of a topical solution which combined estrogen and minoxidil to an alternative solution that contained finasteride and minoxidil, and also a placebo study. What it found was that the finasteride and minoxidil combination was significantly more effective than the estradiol and minoxidil combination. They were looking at 119 postmenopausal female patients, but it is worth noting that there was a significant improvement in hair loss for those patients using the estradiol and minoxidil combination. Now, Mike, I guess we're getting into the esoteric here. Have you got any more?
Yeah, so I'd look at microneedling, and this looks pretty brutal, I'll be honest. This, as you might imagine, is needling the scalp repeatedly. And some of these devices, they look like medieval torture implements, whereby there's a roller with loads of spikes on it that you have to run up and down your scalp, very much like you were mowing your lawn. The theory behind this, again, is it stimulates your blood flow, causing these micro injuries, and this can increase collagen and growth factors. There is actually a little bit of evidence that it might augment the use of, again, minoxidil and finasteride. Significant risks here, particularly if it's not done right. So the feeling is that you need that penetration in the scalp to approximately 1 to 2 millimeters, but if you do it too far, you can cause damage to the scalp and actually worsen hair loss in the long run. It's also potentially going to increase your risk of infection of skin as well. Again, looking just ballpark, this is not a cheap procedure. It's about 200 quid a session in a couple of the places I looked at, and they would recommend at least 6 sessions. So I guess something to consider, but approach with significant caution. I've also had a look at biotin. So this is vitamin B7, and it's offered by a number of companies. Essentially, there's no convincing evidence for this unless you have a biotin deficiency, which if you eat reasonably well, you probably won't. And then the final one I've looked at, again, often used in combination with biotin, is PRP. So this is platelet-rich plasma. This is spun out from a blood sample that you have taken and then injected back into your scalp. Which again sounds pretty brutal. There is a little bit of evidence that it works. Interestingly, the feeling is that it works better for some people than others, but it's difficult to say who those people are going to be. It also doesn't have long-term effects, and it is expensive.
So I'll finish off with the last few. So I've looked at collagen peptides. Again, this is a supplement that you can take either from fish or from bovine sources. It costs around £30 a month. Anecdotally, again, my wife took this before our wedding. She was taking it for her skin. She said that her hair did become luscious and thick. Interestingly, looking at this though, there is no collagen in hair. Your hair is made of keratin. And now I did find a study that was suggesting that some in vitro studies looked at collagen and how it actually stimulated certain growth factors within the hair follicle. So there is some trivial evidence that this might have beneficial effect, but again, I wouldn't rush into a big subscription of collagen. Botox injections, would you believe? So the theory behind this is that if you inject the frontalis muscle, for example, this can relax these muscles and increase blood flow. I would not rush into this. This is going to cost you an absolute fortune, and I'm very dubious that there's any significant evidence there at all. Lastly, but certainly not leastly, we should round this off by just mentioning again that vitamin deficiency. So there's certain things that if you're deficient, then replacing these will improve hair growth because they are important for hair growth, follicle nutrition. So this is iron deficiency, vitamin D, and also those who are protein deficient. And then lastly, we should probably mention hair transplants as well, shouldn't we? I'm aware that this will cost you somewhere between £80,000 and £20,000 in the UK, whereas that flight you talked about to Turkey will cost you somewhere between £2,000 and £5,000, depending on the extent of the transplant that you need. This is basically harvesting the hair follicles one by one, typically from the back of the head, and reimplanting them to a specific part of the head that you feel like you need it most in. But again, this is going to cost you a lot of money. So Mike, rattling through that list, that's quite an exhaustive list, isn't it? And there's quite a lot of experimental stuff there without much in the way of evidence. And I found myself pulling my hair out just reading some of it. Sorry for the terrible pun there. What are your concluding thoughts on this topic?
Yeah, it's an interesting one, isn't it? Because I think It is clearly a very big issue, and it's one that people are potentially a little bit embarrassed to address. It's worth pointing out that we haven't said this already, that most of these are not available on the NHS. As GPs, you certainly do a few private prescriptions for finasteride for hair regrowth. Actually, now it's moved more to these online companies where you can do the subscription yourself discreetly. I think my takeaways from this is that there are some medications that could potentially work. They are not, however, without side effects. And I would really just emphasize my concern about some of these products that perhaps the side effects are not being fully explained or they're being underplayed. I think the other takeaway here is that there are a whole number of different causes of hair loss. So it's not a one size fits all. It's not a case where you say, okay, I'm losing hair, it's coming out in clumps in the shower, I need to immediately go on finasteride necessarily. So it is important to actually know what we're dealing with here. And as with the themes in a lot of these podcasts that we do, just be careful what you're looking at online in particular. The old adage goes that if it sounds too good to be true, it probably is, and that's the case with a lot of these products as well.
Certainly, I think what I've learned is that most hair loss is androgenetic, it's preordained. A lot of these products are just going to stem the flow of loss using these various products. Unfortunately, it's likely to be quite expensive though, and you're going to need significant patience, aren't you? So that the hair cycle is long, you're not going to see any change for several months. It's going to really test your dedication and your routine, and you're probably going to be challenged by various things along the way, like disappointment or change of your routine or some inflammation of your scalp. And I think staying with it here is an important thing to mention if you're going to commit to one of these products, and that the response to individual products can vary hugely for different reasons, and I don't think are particularly well understood from patient to patient. I think it's also important just to mention that if you do experience sudden hair loss, then you probably should speak with your GP, speak with someone who knows what they're talking about, because a lot of these products might not be suitable, and there may actually be an underlying principal reason that's driving your hair loss.
Thanks for that, Matt. I just wanted to add one more thing. This is our 10th episode, so thank you to everyone who's listened and everyone who's reached out with such lovely feedback. It really does mean a lot. Please continue to listen, share it with your friends. And if you have any feedback or any topics that you would like us to cover, get in touch. We're always open to suggestions. We've got a couple lined up with some excellent guests coming on. But please do drop us a line. We've got an email address, which is beyondthelimitspod@gmail.com. So please drop us a line, and we would be delighted to hear from you. Cheers, Matt. See you next week.
Thanks, Mike.